Good evening to all the delegates and our eminent speaker. Thank you all for joining this evening. I am Siddhant Sharma on behalf of Hetero Healthcare. Welcome you all for webinar on Introduction to Bempedoic Acid, non-statin lipid-lowering agent in the management of uncontrolled LDL-C. As you know, lifestyle disease in our country is on rise and it's surprisingly moving towards the chronic stage. We at Hetero Healthcare has always been at forefront along with your site to deal with such ailment. This evening, our esteemed and experienced doctor will share their experience on the subject. Before proceeding further, do let me take the privilege to introduce our eminent panelist. Dr. Prakash Ajmera is the Director of Cath Lab Department at Mallareddy Narayana Multi-Speciality Hospital. He has participated in both multinational, national and international level of conferences like ESC Congress, EPS RFA Workshop, Cardiology Update and Europe PCR in the year 2017-18. He has done more than 5,000 cases of intracath procedures, including coronary angiograms, PTCA, balloon valvulotomy, pacing, LM stenting device, and IABP insertion. Has also completed more than 10,000 2D echocardiogram, more than 100 DSC, and 500 TEE. Also, I'm glad to introduce our second panelist, Dr. Vajja Pradeep. A warm welcome to you on the scientific talk. Dr. Vajja Pradeep is MD from the Buckingham Medical University. He has fellowship done in diabetology FID, associated with Bhaskara Multi-Speciality Hospital and Haritha Hospital as a consultant. So I now welcome Dr. Prakash Ajmera and invite him to take over the session.
Good evening. Thanks, Petro, for invitation. Good evening, all participants and co-chair. So today we are going to talk about bempedoic acid, the non-static lipid-lowering agent. This has got FDA approved in now yeah. So if you go straight away go into the topic. So prevalence of dyslipidemia has a major impact on cardiovascular. Yes, in urban it is 25 to 30%. Next slide, please. So prevention and treatment of cardiovascular. Right. So individuals in the age group 30 to 40 years have a high prevalence of which goes on with the age further increases of 60 years. So coming to the Indian patient, so Indians are highly prone to develop atherosclerotic cardiovascular disease in early age when compared to the West top. And this 2/3 of the deaths due to non-communicable disease are caused by cardiovascular disease. And this is the dyslipidemia is the more major risk factor causes cardiovascular. So what are the cholesterol? What the desired level of cholesterol? So total cholesterol should be less than 130 milligram per day. Non-HDL less than 100, and LDL cholesterol should be less than 100 milligram per day. And HDL cholesterol should be more than 45 milligram per day. Next slide. Next slide. So now comes the current. What are the current challenges? Gaps in the cholesterol. So like cardiac arrest. So according to European Society of Cardiology guidelines, so
Doctor,
LDL.
Sorry, so your voice is breaking. Can you keep your mic towards?
Hello.
Yes,
Okay.
it's audible.
Now,
Yes, sir.
oh.
My apologies, Siddhant. I think you should take it from the first slide. Since the beginning, it's like that. Hardly few words are heard.
Okay. Again, we'll go from beginning. And
Okay.
to stop me where. Hello.
Yes.
Siddhant, take it back to the first slide.
Yes.
Yeah. So just talked about the prevalence. So urban population 25 to 30%, rural 15% of 20 difficult to meet. And this has a major impact on cardiovascular morbidity as well as mortality. Next slide. And prevention and treatment of dyslipidemia is essential for prevention of cardiovascular disease. Next slide, please. India, cereals in the age of between 30 to 40 years have high prevalence of dyslipidemia, and which increases with age and more up to years. Let's see. Coming to the Indian patient. So Indian patients have young patients are more prone to dyslipidemia, where the counterpart of patient population. And almost two-thirds of the non-communicable diseases are due to the cardiovascular disease and due to the next slide. Next slide, please. Next slide. Hello. What happened? Hello. Hello.
A
Am I
moment.
audible?
I think Siddhant got disconnected. Doctor, he's connecting once.
Oh. Is it audible? No. No.
Yeah, now it's audible.
Hello, Vijay.
Hello.
Hello.
Yes, sir. Yes, sir.
So,
Siddhant, are you there?
This came.
Siddhant, we can see your mic.
Slide market came. Shall I try?
so
You
one
can do
minute.
that, doctor.
You just keep the came. Came. Yeah. Okay. Go to next slide. Okay. Normal cholesterol level should be total cholesterol less than 170 milligrams per deciliter. Non-HDL cholesterol should be less than 120 milligrams per deciliter. LDL cholesterol less than 100. HDL cholesterol should be more than 45 per deciliter. These are the desired cholesterol. Next slide, please. So, what are the current challenges and gaps in cholesterol? Right? So, as per European Institute of Cardiology, so LDL cholesterol plays a key role in the development of atherosclerotic plaque, which subsequently cures cardiovascular disease. So, many patients with hypercholesterolemia remain above guideline LDL cholesterol despite treatment with maximally tolerated statin doses with or without addition to non-statin and thus remain at elevated risk for cardiovascular disease. So you can see here what are the how the cardiovascular affects high cholesterol. So this you can see that the high cholesterol level leads to fatty deposits, blood resistance, plaque rupture, then clot formation, maybe. what are the current treatment options? What we are having? So statins, we all know, atorvastatin, rosuvastatin, statin, makes cholesterol of the blood system. And this ACL does Bempedoic Acid, which is another bile acid binding agent, cholesterol, cholesterol, PCSK9, development map, and fibrate, fibrate, and omega 3 fatty acids. So we are interested about Bempedoic acid. So we'll why uncontrolled LDL? What is the cause for this uncontrolled LDL? So as per cardiovascular drug therapy, 80% of patients treated with statin not as optimal LDL because high baseline LDL cholesterol levels are high tolerance or aggressive LDL cholesterol control, lack of sufficient statin effect, or smooth statin effect. Another thing is due to adverse effects of statins, like primarily the maximally tolerant statin doses to low doses, and which may make patients not adhere to their treatment or stop the statin therapy completely due to the muscle cramp. Right? So, what are the challenges of statin therapy? So, residual risk will be there. The statin therapy has cardiovascular disease like 37%. So, however, the residual risk is still for despite of but to major vascular about 20% and non-attainment of LDL cholesterol target. So only 37% of patients on moderate to high statin monotherapy active LDL cholesterol level less than 7%, and only 20% of patients family has a hypercholesterol of LDL cholesterol. Maximum dose of other 80% of hypercholesterol and almost
Sorry,
70%.
doctor. Can you please keep your mic close to this? We are not able to.
Okay, huh? Okay. Now, okay.
Yes, it is visible. Yes, sir. Yes, sir.
Okay. So non-attainment of LDL cholesterol target level is another challenge. And also another thing is third most of non-adherence. So some patients are intolerant to high dose statin therapy due to adverse effects, myotoxicity or hepatotoxicity. So while some patients start using statin due to specific factors, so these are the challenges: statin intolerance and muscle weakness. Which stop this statin, stop, which is the dose. Thereby, LDL cholesterol, the goal of the LDL cholesterol level not be achieved. Next slide. So hence the need for new add-on treatment could help reduce hypertension. There comes our Bempedoic acid. Next slide, please. So this is the Bempedoic acid. So this is the drug used in conjunction with lifestyle modification and other agents in treatment of refractory hypertension. So this is the lipid-lowering agent. So this is the ACL inhibitor. The oral tablet form strength is 180 milligrams oral per day. Next slide, please. So absorption observed rapidly. Uh, there is food has no effect on biology. AMAX is to 24 hours. Plasma protein binding 99% protein binding. Metabolism peptidic acid reversibly converted to active metabolite and efficiency during 70%. Next slide, please. So coming to the how metabolize and how it acts. So this is the prodrug when it goes to liver and kidney with help of acyl coesterase 1, it's converted to the active form of molecule. Bempedoic, then this at the from citrate to acetyl-CoA that step. So inhibit the acetyl-CoA the citrate step, which inhibit to convert it to the acetyl-CoA. This is the same pathway where statin works, but it's almost 2 steps ahead of the statin. Right? You can see here, citrate after that convert to acetyl-CoA. Acetyl-CoA comes to the HMG-CoA, then so statin will inhibit the HMG-CoA receptors, and this Bempedoic acid inhibits the citrate to acetyl-CoA. Like this. So here, mainly liver and kidney. So muscle acts very less. So muscle side effects, myopathy are very less. Like this. So this is liver and kidney not so therefore the acute peptide is liver. Medication adherence is more as side effects are less. If the muscle weakness, those will not be a problem with this Bempedoic acid, as statins are causing this. Next step is slide. As usual, the FDA approved in 21st February. Combination is approved in and it is a add-on therapy. It's like now we are using as a first we'll use statin, the maximum tolerated dose or maximum dose. Then we'll add still if patient is not we are not able to control the LDL cholesterol level, then only we can add Bempedoic acid. Or if patients are not tolerated or severe myopathy or where we cannot use statin, we can directly use. And we also this heterozygous familial hypertension. Also, establish cardiovascular. Next slide, please. Right. So, where can use monotherapy? Patient with sepsis can use supplementary non-HDL cholesterol, HDL cholesterol, greater than high high sensitivity C-reactive cholesterol. In patient with type 2 diabetes, Dr. Pradeep will tell us, and 43% reduction LDL cholesterol levels, 41 reduction HDL. Patient with both hypertension, the significant portion of LDL cholesterol by 25% decrease in
Doctor, can you please keep the mic close to you because you can't, please?
Hello? Is it okay?
Yeah, it is audible. Yes, yes. Thank you.
Problem is earphone. So Bempedoic acid combination. So we can combine with statin. So reducing LDL cholesterol level by 20%, safe and effective language statin. Next, right? Yeah. So what are the indications of Bempedoic acid? So hypercholesterolemia, as we all know, indicated as an adjunct to diet in maximally tolerated fatty patients in adults with heterozygous familial hypertension established cardiovascular who require additional lowering of LDL cholesterol. Dose is 180 milligrams per day. Next slide. And drug interactions are that avoid greater than and Kawasaki greater than 40 milligrams. Next slide. So what are special populations not use pregnancy, not use practice, breastfeeding, not pediatric with deficient, not right? So what are the adverse reactions? Bempedoic acid. So most common adverse reactions are upper respiratory infection, spasm, hyperuricemia, back pain, abdominal pain, bronchitis, pain, anemia, elevated liver. Among this, only hyperuricemia is the concern. Other than that, not. Right? So elevation serum tests have occurred and assess uric acid periodically as condition. You have to be careful. OTP. So what are the clinical trials? What are the evidences the supporting bempedoic acid? Sir? Next slide. So these are the two trials, randomized clinical trials, clear study, clear wisdom trial, clear harmony trial, clear tranquility trial, bempedoic acid, bempedoic acid type of tablet. So these are the trials. So I will tell about four trials. Next slide, please. Right. So clear trial, they studied the efficacy, safety, and tolerability of bempedoic acid. And taken 3.5, the mean age was 65.2 years, and they checked from baseline to 12 weeks. Conclusion was bempedoic acid was safe, well tolerated. The most common muscle related adverse myalgia according to 4.7% bempedoic. Next slide. Next comes clear harmonic trial. Here also evaluate safety, efficacy of bempedoic acid with long term effect. So that was the short term. This is the long term qualification. Type was guideline recommended statin therapy. So here they have taken more patients. So 2030 patients, 1488 per day, 742 to plus. And conclusion, trial long. So treatment with bempedoic added maximally tolerated factor not lead to higher overall adverse than placebo and led to significantly lower LDL. Trial, clear wisdom. This trial to assess efficacy of bempedoic acid versus placebo in patients who are high risk, high cardiovascular, between maximal tolerated liquid dose. So here they have taken 700 and also they have taken atherosclerotic cardiovascular and heterozygous familial hypertension and both. What they concluded is among patients with high risk cardiovascular disease between maximal tolerated addition of bempedoic acid compared to placebo with significant lowering of LDL cholesterol quality. So all trials they have from baseline they have taken the LDL cholesterol level and 12. Next slide, please. Right. Clear tranquility trial. So aim of this trial is again efficacy and safety. So when added to the lipid modified of statin to require additional more lowering of LDL. Here only small trial 181 conclusion is again bempedoic acid well tolerated, provide oral therapy complementary to statin tolerance. So here you can see clear harmony, clear wisdom study. So clear harmony, clear wisdom study, a persistent hypertension despite normal target statin therapy. And clear tranquility, clear serenity, still the patient like hypercholesterol but unable to tolerate statin. So statin withdrawal that clear tranquility and clear serenity. Persistent hypertension despite maximum dose of statin, clear harmony, clear. So all trials showed uh, more efficacious and when added to a statin as well as given alone. Next. Again, same. Next slide, please. What are the key points? So, no concern when renal impairment. So, no doses assessment is necessary renal impairment patient, mild to moderate, and not having end-stage that we have to. And again, hepatic impairment also there is no doses assessment, but not studied in patient with severe hepatic impairment. Monitoring all patients. Assess serum uric acid when clinically indicated, and prior history of gout should be asked. So if it's there, then this evidence is there with hyperinsulinemic gout. And patients more than 6 years of age are taking steroids. It's careful. You have to monitor again. And the one of potential for tendon rupture and adverse patient first sign of tendinitis or anything like that. Right? And discontinue as we already the pregnant and breastfeeding lactation. So next, next slide. This is again another trial. They have taken Bempedoic Acid and hypercholesterol, 1198 patients. Next. What they have concluded is Bempedoic Acid added maximal to tolerate statin, including moderate to high intensity statin or no background statin. This is versus placebo in patients have acceptable safety. So all trials telling us the same. Next slide, please.
Doctor, there is some comments on this. The voice is
Yeah.
not very clear to the audience.
Okay. Okay, we'll stop here. So next slide, Dr. Pradeep will tell us about diabetes and uncontrolled LDL. So till now, is it audible?
Yes, doctor.
Okay.
Yeah.
So to summarize, so though we have statin other inhibitory drugs, why we need this Bempedoic acid? So many patients we are not able to use the LDL cholesterol at the target level, like less than 20, despite giving high statin, two dose statin, and some other patients like they are not tolerating statin due to adverse effects. In those patients, we need to have safe drugs which can reduce the LDL cholesterol good thing. So there is the Bempedoic acid will come. So this is the mechanism that same pathway, but 2 steps ahead of the statin. And, this decreases the production of the cholesterol. Okay. So they have studied this is the oral drug can give orally when it becomes once a day, and safety profile is well evidenced by the trials like 4 trials has been scope. So all our trials are telling that can use as an add-on drug like first lifestyle modification, then full dose statin plus histamine. Still, you are not able to control or not able to get the target then you can add. And in some patients who are not able to tolerate lighter dose of statin also, you can give this as a first line histamine. There also it works well. This is the conclusion. So Dr. Pradeep will tell us about the diabetes. Is it okay?
Yeah.
Over to you.
Can you hear me? Hello?
Yeah.
Yes, you're audible, doctor.
Yeah. Yeah, thank you. I'm Dr. Vajja Pradeep. I'm a MD physician. Also, I'm a registered endocrinologist from Royal Bend Hospital. Today, we will briefly discuss about endocrine aspects of dyslipidemia and use of bempedoic acid in endocrine system. Today, firstly, we'll discuss from the basics, like what is dyslipidemia. Dyslipidemia is nothing but abnormal cholesterol or fats, which is nothing but lipids. That's called as dyslipidemia. Anything like low HDL, increased triglycerides, increased cholesterol, all this comes under dyslipidemia only. India is in the middle of an epidemic of atherosclerotic vascular diseases, as Dr. Prakash had told. But today, the prevalence of dyslipidemia is more than 79% among Indians. In India, it's more than 79% actually. That is very high compared with the other population. First country which those who have very high incidences like US, it was 81%. Second is India, which is 79% of dyslipidemia prevalence, like in anything like low HDL or high triglycerides, something. Not only cardiovascular diseases, there are some endocrine which there are some endocrine diseases also associated with dyslipidemia. Today we'll discuss like what are the endocrinological aspects, like the relationship between lipids and endocrine function, which is called lipocrinology. We'll discuss about lipocrinology now. Firstly, to discuss about that, we should know what are the importance of lipids, what it actually do. Lipids actually helps us in energy production and also in cell membrane. Lipids help in cell membrane. Sorry, it got disconnected. Okay, like layer insulation, which means below skin there will be fat layer there. It protects body. That's also made up of lipids, and also it helps in thermoregulation and steroid hormone productions. Like steroid hormone production means like corticosteroids, like sex hormones. These all are produced from lipids only, and also bile acid formation, which is like bile synthesized from cholesterol, and transport signaling. These are vital roles which lipids play. Now we'll discuss about dyslipidemia and endocrinopathy. Dyslipidemia coexists frequently with type 2 diabetes and obesity. What happens in type 2 diabetes and obesity is that decreased HDL cholesterol. Dyslipidemia coexists frequently with type 2 diabetes and obesity, which in this what happens, every patients have low HDL or increased triglycerides. I can see in all patients who come with diabetes and obesity. Similar abnormalities I can see in patients with PCOD and acromegaly. While in Cushing syndrome, what happens is there will be hypercholesteremia. And directly we'll go to bempedoic acid in type 2 diabetes and how it is useful in type 2 diabetes or pre-diabetes or normoglycemia. We'll discuss directly about that. To evaluate the effect of bempedoic acid on glycemic and lipid variables, we will discuss, like we took around patients of 3,621 patients. Treatment given to the patient and treatment given to the patients who maximum tolerated to statins, and hello. Who is maximum tolerated to statins, whereas not tolerated to statins, like for those who have myalgia, we gave to that type of patients also. But we gave around the oral bempedoic acid of 180 mg to 180 mg from 12 to 52 weeks. Okay. In that you can see, you can see in that graph. In that graph, patients with diabetes or pre-diabetes or bempedoic acid, given bempedoic acid, significantly patients are less than 0.0001 reduction of cholesterol was done. Cholesterol means any like reduction of triglycerides, reduction of LDL cholesterol. All was we can notice in that graph. Even HbA1c also minus 0.12% to minus 0.06% was reduced, and it didn't affect fasting glucose. You can see in that graph. The black one is like bempedoic acid patients given to the bempedoic acid, and the white one is placebo, the other statins which was given. You can see in that. Okay, the HbA1 you can see the HbA1c also minus 0.12% to minus 0.06% was reduced. Okay, so what I say in conclusion is that bempedoic acid for up to one year didn't worsen the glycemic variables or increase the incidence of new set of diabetes when compared with placebo. Okay, now we will directly to put in a nutshell, like we'll come to the conclusion, like what Dr. Prakash had told. We'll do it, what happened. Okay, bempedoic acid inhibits. You can see bempedoic acid inhibits ATP citrate lyase enzyme in cholesterol synthesis pathway. You can third or fourth slide. You can see that, and also gives LDL reduction up to 16.5 mgdl to 23.6 mgdl, and it also significantly reduced non-HDL cholesterol, FOB, and decrease of triglycerides and total cholesterol, and high sensitivity CRP also reduced, and at the same time it also reduces HbA1c, which is really good for endocrinological aspect. And also bempedoic acid is indicated as an add-on for patients who's intolerant to high dose of statins. Like even if you give statins for high doses, some people will have myalgia or other gastric GI symptoms. It's better than that. Bempedoic acid is really very good for them also. And we can give those who are maximum tolerated dose, but additional lipid lowering, if they want additional lipid lowering therapy also, this bempedoic acid is very useful, and also in heterozygous family with a hypercholesteremia. Okay, and also it's safe and doesn't cause myalgia or minimal drug intolerance. That is the reason we can. It's better to prescribe bempedoic acid for the patients who want to reduce cholesterols, like rapid cholesterol reduction. So, hello.
Yeah.
Next. Yeah, I think I already told everything.
Doctor, we have some question answers placed in the chat box.
Okay, you can read out.
Okay, how can I check?
You only read out. Jay, you read out, we'll answer.
Yeah, please.
Hello.
Yes, sir. I will read it for you.
Yeah.
So, any specific type of or class of patient where bempedoic acid can be given as a monotherapy?
Yeah. These patients are familial hypercholesteremia, and Patients who are not at all tolerating like, low dose of statin, those patients there is no option. But the other options are there, PCSK9 inhibitors, but again, they are very costly. Get advantage of Bempedoic Acid is oral. Other things, other drugs are even
Okay.
cost is also very high. Those
Okay.
type of patients, here,
Okay. Doctor, with your perspective, with cardio perspective, I would like to, doctor wants to know that treatment protocol, how do you follow the lipid profile for the dose adjustment?
okay. So you mean say when you like follow up and recheck of cholesterol level to ask that. So we give the according to patients who are undergoing PCI like PCS cardiovascular, those patients will give maximum like high intensity statin, so 80 milligram statin or 40 milligram statin. Then after 6 to 8 weeks again we recheck the LDL class. When it is decreasing like less than 70 milligram, then
So,
okay.
sorry, sir, your voice is again breaking.
So, so
Yeah.
after 6 to 8 weeks, we'll
Yes.
recheck the LDL cholesterol. Okay. If it is the goal is achieved, like less than 30 milligram per deciliter, or it's reduced to 50% of which was there baseline, we'll continue the same thing. Or we have to add. Till now we are adding HW, but now we can happily add.
Okay. Doctor, one more question has come, that any change in the lipid profile in the post-COVID cases?
Yeah, definitely there is a increasing it's the more risk. And this may also this also post COVID my patients also again maybe more of a thrombus related, but definitely COVID is like definitely some it's,
Sir, we missed your voice. Please repeat, sir.
post COVID definitely changes are more. And also, we have witnessing more MI cases, myocardial infarction more cases after COVID, especially in younger patients. Maybe that's related to thrombosis and coagulation. But again, we also
Okay. Doctor, one few doctors have this curiosity to know that whether they can start with bempedoic acid, as the primary diagnosis, or they have to use the statin only.
no. Till now, guidance says that it should be add-on. Okay. First, we have to use statin because it is a cost again. We have to see. So first, we have to use statin. Then, if it's not controlling statin or not a target goal, or if it is not already statin, you can add.
Okay.
I think my opinion.
Okay. Dr. Dr. Pradeep, we also want to know from your one question for diabetic perspective. Do you believe that
1 minute.
bempedoic acid had some role in the triglycerides level?
Yeah, actually, it reduces triglycerides, but we have to like with ezetimibe, it works very good actually. But only problem with bempedoic acid is that we can't give in pediatric. Like like pediatric in children with more cholesterol, with the diabetes. There are some children are coming like 6-7 years with the diabetes. We give insulin to them. They have more triglycerides and cholesterol levels. For them, it's not working. But for adults, it's working very good actually. Like in adults, it works very good. Like when I was in UK, they used to give with the azithromycin combination.
Okay. Okay.
Actually, in India, it's like a new molecule, but it was already started in like foreign countries like US, UK. They are giving this molecule. Actually, if everything is finished, like, can I go? Like, I have one
Yes,
emergency case.
the
waiting
questions
outside.
are done. Yeah, just would like to,
Yeah.
it was an indeed pleasure and honor having you here for doing this webinar. We, on the behalf of Hetero Healthcare, we would like to extend our sincere thanks to you and your comprehensive session. And we are sure that the delegates would have got enlightened regarding the molecule, as we have covered all the aspects of the same. And thank you to all the
Thank you.
delegates who have joined us for the warm presence. Thank you, sir. Thank you,
Okay.
Dr. Prakash. Thank you,
Thank
Pradeep, sir, for the
Very
valuable
great.
time.
Thank you, Siddhant. Thank you.
Thank you. Thank you, sir.